Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's media availability. Spanish interpretation is available on ATXN 3. To start, Austin Public Health Director Stephanie Hayden Howard will first say a few words, followed by Dr. Mark Escott, Chief Medical Officer, City of Austin, and Interim Austin Travis County Health Authority. Then, Janet Pichette, Austin Public Health Chief Epidemiologist, followed by Cassandra De Leon, APH Chief Administrative Officer for Disease Prevention and Health Promotion Division. We will then open it up to our pool reporter, who will ask questions on behalf of the media. Stephanie, over to you. I'm sorry, Stephanie, we can't hear you.
Can you hear me now?
Yes, ma'am.
All right. We are so excited that we are moving forward with our neighborhood model. As you recall, this is a model where we bring vaccines into the community, where we are working very closely with partners and want to be near where individuals live. Really wanting to focus on areas that have been severely impacted by COVID-19. And so as we continue to partner to just basically meet people where they are with our vaccines, we are continuing to remain flexible. At all of our locations, you have the ability to do a walk-in. You don't have to have an appointment. If you choose to have an appointment, we are still scheduling those as well. It is going to be important that as we continue to move along the path, that we are working very closely with several of our partners. We are going to be working with schools, apartment complexes, in the faith-based community. We will be, tomorrow, we will be out at Greater Mount Zion Baptist Church, as well as Mendez Middle School. So those are just a couple of examples. That information, we have put the links on our website. So if you are interested in attending those, please feel free. You can always reach out to 311. We want to be as flexible as we can be. With that, I'll transition over to Dr. Escott.
Thank you, Stephanie. Good morning. I'm excited to see that our cases continue to drop, our hospitalizations continue to drop, with only 105 individuals hospitalized as of yesterday. Looking at the numbers and the trends, it appears that as early as today, we may enter into stage 2 territory. Now, of course, we want to continue to monitor the data and ensure that we stay there and are continuing to go down. But that means a possible transition into stage 2 as early as next week. This didn't happen by luck. It's happened because of our community's commitment to making it happen. The commitment to be vaccinated, the commitment to continue to wear masks in public, to safely distance, to continue to stay home when we're sick. These things that have brought us to this point are important to continue as we move into next week and next month. With these commitments, we will continue to drive down COVID-19 and we'll continue to save lives and save people from hospitalizations associated with this terrible disease. So we're hopeful that we will continue these efforts. We will, if we transition into stage 2, revise the health authority guidelines, which may relax some of those restrictions, particularly for individuals who are vaccinated. So again, our hope is that commitment will continue and that we will continue to see improvements across our community. I do want to mention that for the last 7 days, 85% of the new COVID cases have been in individuals less than 50 years old, which tells me that we have to work harder to get individuals under 50 years old vaccinated. That's where the transmission is happening, and I would strongly encourage folks of all ages who are eligible now to get vaccinated, but particularly those younger individuals where we're seeing the disease transmission continue. With that, I will turn it over to Janet Pichette.
Good morning, everyone. as Dr. Escott has mentioned, our cases are plateauing, and what we've seen a 50% drop in cases from the point of time where we were last week, which is good for us. However, our role in epidemiology for Austin Public Health is beginning to transition, and our focus is starting to become investigating those variant cases that are circulating in our community, as well as we're spending a lot of time beginning to track vaccine breakthroughs and reinfections. We continue to hope to investigate that so that we can figure out where those cases may have traveled to, what kind of exposure they've had, who they may have interacted with. So there will be a lot of work investigating those types of cases. It's important to remember, though, this just highlights the importance of vaccination. If you haven't been vaccinated, there is a possibility you could be exposed to a variant strain of this virus. We have recently seen in the Houston area, they've reported 4 cases of the Indian variant that is the mutant variant that's been circulating and causing such devastation in the country of India. So, we want to be careful and mindful and continue to practice prevention when possible to protect yourself and others, especially if you have not been vaccinated. Again, we're also looking at breakthrough cases that are individuals who've been fully vaccinated to see if there was a difference in the type of vaccine they had, and trying to investigate what might have caused that breakthrough to occur. We know that it's not always 100% effective to get vaccine. However, the success and the efficacy is very high, so we want to really understand what's causing these issues. And with that, I'll just turn it over. One other thing I did want to mention is that beginning May 15th, we will begin reporting our daily case data out on a weekly basis. So we will not be reporting over Saturday and Sunday or on major holidays. The EPI staff are going to be getting a much needed break after 14 months of pretty much working every single day, including holidays. So we'll be reporting out Monday through Friday, and then we'll have a new update beginning on Monday. So we'll be reporting those cases out, but that change takes effect May 15th. And I'll turn it over to Cassie DeLeon.
Yes, good morning. Thank you, Janet. And definitely want to reiterate the importance of getting vaccine that many of my colleagues have already mentioned. And also want to really talk about that we're really excited that there's a lot of vaccine supply in our community from a lot of different outlets. And so you have a lot of choices where you want to get your vaccine. From Austin Public Health specifically, we are currently opening up all of our vaccine sites for anyone who needs to walk up and get a vaccine. You don't need to worry about trying to schedule an appointment, trying to register. All of that can be done on site, and you can easily get your vaccine. I want to note that our Tony Berger Center is a drive-through site, and it is available for walk-ups, as well as the Delco Center is allowing for walk-ups. We do encourage that you call 311 to ensure that if you're planning to get your vaccine, you verify the times and locations of where you can get vaccine from Austin Public Health. But note that we are providing vaccine within the community on Tuesdays through Saturdays. So any one of those days, you should be able to get a vaccine in a walk-up location. Also note that Austin Public Health is trying to reduce any and all barriers, in addition to the kind of community-based outreach that we're doing at those major big sites that we're providing vaccine at. You don't have to have an ID. You don't have to bring proof of insurance. You don't have to bring anything other than just come and get your vaccine. And there is no cost. So we really want to encourage everyone just to come out and get vaccinated. If you're looking to get your second dose and you're having difficulty, no worries there. If you're at that 28-day, you can walk up to any site and get your vaccine from Austin Public Health. Again, we do encourage that you contact 311 and get information about where you can get vaccinated and what the hours are so that you can ensure that you can maximize your time and take care of that. Again, we're trying to offer as little barrier as possible. We want everyone to get the vaccine because there's so much available. There really is no barrier and there's no excuses. Now everyone can get access. Everyone can protect themselves, protect their family, and protect their community. So encourage everyone, get vaccinated, encourage your friends, your family, and anyone you come into contact with. This is the best thing we can do to tamp down this disease and get back to a life where we don't have to worry about this COVID situation. And with that, I'll open us up for questions.
And it is free, correct, Cassie? This service that we provide to the community, it's free, and I think that's
absolutely. It is free. There is no cost to anyone coming to one of our clinics.
Thank you, Cassie. All right, at this time, we will now open up questions to our pool reporter, Sally Hernandez from KXAN. Sally?
Thank you. Thank you for letting us ask you these questions. First question comes from us here at KXAN. Can you detail how you would like to see APH give incentives to people to encourage them to get the shot, whether it's the first shot or the second shot?
We are engaging with businesses and grassroots service providers, having those conversations about what potential incentives would look like. One of the things that we know is that it is important for us to continue with those relationships that we have established, to be able to kind of look at this more holistically. It's important for us to know that even looking with businesses, if they're willing to allow folks to have the time off to be able to go and get that vaccine, is just one of the examples that we know would very well work. The other thing that, in conversations with businesses, if they will allow Austin Public Health to be able to come by, have a clinic day at their operation. And so, and then allowing folks to come whenever they can, not using their break time or their lunch time. And so we are continuing those conversations about incentives.
I'll also just mention that when we think about incentives, we're not just talking about monetary incentives. We're talking about non-monetary incentives as well. And what I mean by that is increased freedoms or relaxations for those who've been fully vaccinated. And that's certainly something that we're looking at from the policy side as well. When we look at revising the health authority rules, some of those revisions will allow for more flexibility for employers to allow non-masking for individuals who are fully vaccinated. But certainly there are other ways to incentivize that don't involve money. And we're certainly encouraging, as Director Hayden Howard said, we're encouraging those businesses, those business owners to think about how they might provide some incentive to ensure that their employees get vaccinated.
Okay, next question comes from the Austin American-Statesman. Dr. Escott, can you please provide clarity as to why you feel it necessary to focus only on your role as Chief Medical Officer? What practical effect will that have on your role advising the public on health matters?
Well, before this pandemic began, my role with the city was to serve as the EMS System Medical Director, supervising our 2,000 EMS and fire department personnel who are providing clinical care to 100,000 people a year in the city and the county. The Chief Medical Officer additions also have me providing oversight over the other clinical services within the city of Austin. So, we have a real opportunity here with this new role to provide better strategic alignment between city and county services, between departments within the city, but also really strengthen those relationships that have been built over the past year and a half with our other stakeholders in the community, our major healthcare systems, community care, integral care, central health, and others, so that we can identify opportunities to improve those services, those clinical services, particularly when we are looking forward at the recovery phase of this pandemic. those clinical services are going to be critical, particularly for those individuals who have lost jobs, lost health insurance benefits, to ensure that they have an affordable way to access those healthcare services.
One thing I would also add is that with Dr. Escott, we're very grateful for the time that he has spent with us at Austin Public Health. As we onboard the other health authority, he will continue to work with that individual. And as he stated, other clinical professionals across the city, we feel like that this elevated role definitely moves us to the next level as the city of Austin. The established relationships that we have made during this process with the pandemic, we want to be able to continue those relationships. We want to be able to really be able to look at from start to finish. Austin Public Health is concerned about the prevention aspects of work, as others are looking more so at the clinical aspects. So when we pull together the work that EMS and fire are doing, as well as public health, that synergy is going to be really great. It's going to take us to the next level. But when we also think about the major healthcare providers that have been at the table throughout this pandemic, there are so many other things that we will be able to do as a city and a county. So this is a huge plus for us with the elevation for him in that chief medical officer role.
Okay, thank you. Next question is from Community Impact. Are there any plans to wind down operations at mass vaccination clinics to focus more on targeted outreach efforts and the neighborhood model?
Yeah, I'll jump in. We definitely are assessing the uptake at the mass vaccine clinics at our Tony Berger Center location and at the Delco Center. We know that that's provided a significant resource for the community. Then there's a lot of factors that are needing us to think about switching our model and increasing the community-based outreach and reducing those mass locations. One, those locations were generously provided by AISD, and they need to get back to using those locations for specific use that the school district needs. And so that's one piece, but also we have a lot of resources are required to stand up those mass vaccine clinics. And we're seeing that people really need to have some other options to access vaccine. And so we're seeing an important time to pivot to really supply some of our efforts that we've been pushing into mass vaccine clinics into more of these community-based efforts to really reach people where they're at. So we are working through the month of May to transition from those mass vaccine clinics and making sure that we still have enough capacity in the community to meet those mass needs, but transition more into that community-based model and ensuring that we have enough of standing locations for people on a daily basis to be able to reach and get vaccine every day, but also working to make sure we have a presence in any place and every place that there's a need and a want to provide vaccine. And so that's what we're working to do, is try to shift those resources so that we can meet anyone where they're at and make sure that there is, again, no excuse for people to not get their vaccine, and that we've reduced any and all barriers to receiving vaccine.
Okay, next question comes from KOOP Radio. It is almost 6 months since the first phase 1A vaccinations. Has APH been testing for antibodies in this group to determine the efficacy of the vaccine over time?
I'm happy to take that one. APH itself has not been doing antibody testing for individuals that we've vaccinated, but those tests are ongoing, and those are being done by the manufacturers and others to ensure that they're monitoring the potential for waning immunity. So we'll look forward to continue to monitor that data through those entities. We do expect at some stage that there'll be waning efficacy, which will determine when and if booster shots are needed. Our big concern right now is the introduction of new variants, which may threaten the vaccine efficacy and may require reformulation of booster shots, similar to what we do for flu. So again, I think our focus right now is getting the vaccine into arms. We know the vaccine is very, very effective for the initial strain, plus some of the newer variants. It really is still a race against time, so that we can beat this virus before a more competitive variant emerges that threatens the efficacy.
Thank you. Next question comes from CBS Austin. How do you expect vaccine distribution to be handled for 12 to 15-year-olds in the Austin area? And do you think there will be delays in getting appointments like there was when appointments opened up for adults?
I'm happy to start. We have more than 100 providers that can provide shots to these young people. We know that there's about 60,000 or so individuals in our community in that 12 to 15-year-old range. So it's not a huge increase of individuals that would be eligible for vaccination. So I don't anticipate any challenges or significant delays in the availability for 12 to 15-year-olds. I would certainly encourage that parents across the community, as soon as it becomes available for that age group, to get it.
I'd like to just add in, there are a lot of providers that are providing the Pfizer vaccine. This is an opportunity to, again, talk with your provider and make this a special time for if your family hasn't been vaccinated, for you and your child, for the entire family to get your vaccine. This can be a really important step, and adults can be the role models for their kids and get the vaccine all together. So check out where there is Pfizer available. It's our understanding that the vaccine that is currently being provided is the same vaccine that will be provided for the 12 to 15-year-old age group. And so really start planning your vaccine for your family and identify where you'd like to get those vaccines done. And reach out to your own local healthcare provider to get advice on what they recommend and seek out those options.
Okay, next question comes from KUT. Do you think that we can still reach herd immunity with new strains spreading and the amount of vaccine hesitancy present? If not, is there a different threshold for getting us back to normal operations we should be aiming for?
I'm happy to take that one. The issue is, can we reach herd immunity as a state? Can we reach herd immunity as a country? Or can we do it locally? I think for certain we can do it locally. I think the experience over the past year has demonstrated that Austin and Travis County and Central Texas are committed to doing what it takes to conquer this disease. The whole state, the country, the world is going to be a much more difficult challenge. As I said before, we are concerned about the variants. We're concerned about the ability to eradicate COVID-19. And given the global situation and the disparities across the globe in terms of access to vaccines, I think eradication is very, very unlikely to happen. But I think locally, we will be able to achieve herd immunity because of that commitment to from our community. And my hope is that people will continue to make the choice to be vaccinated and to do that soon.
Okay, next question comes from KView. Do you have any advice for parents who are on the fence about getting their kids 12 to 15 years old the vaccine once it is available?
My advice is this, and I know there's a lot of concern about the safety and the efficacy. I think that what we have seen in this process is that there has been a very thorough investigation, a complete scientific approach to this vaccine. That piece has not been fast-tracked, and there's a lot of confusion about this. The piece that was fast-tracked was the fact that large volumes of vaccine was manufactured prior to approval, so that if approved, it could be rapidly distributed. And that's what we've seen, and that's why America is leading most other countries in the vaccination effort, because of that foresight through Operation Warp Speed and other similar measures from manufacturers themselves. So I don't think there should be worry about this process going too quickly. I think it's been very thorough. I think the question for the future is, could we have done it even more rapidly? And I think when we talk about specifically the addition of 12 to 15-year-olds, I have complete faith in the FDA's process for reviewing and approving these vaccines. They will do so. They will consider this addition, and if it is approved, that will be a clear indication that the benefits of the vaccine for 12 to 15-year-olds outweigh the risk of the vaccine. We have to remember that COVID has killed more than 550,000 individuals in this country. It's killed tens of thousands of people across Texas, and certainly had a terrible impact here locally. I think it's up to all of us to take the vaccine when it becomes available for us, so that we can reach a better place, we can save lives, and hopefully get back to normal again.
One thing I would add, as a parent, who really understands from a public health perspective that immunizations are very key in the life of as you're raising your child. Really get the information that you need. If there are questions that you have, ask those questions. Don't think that any question that you may have, it's a question that you shouldn't ask. When you're thinking about the care of your child, any question is not off limits. So always know that you can get the information that you need. But my hope is that parents will give their child this vaccine. As we think about having kids in school, and being able to be with their friends the way they really love to be, and how young people like to participate in whether it's sports or theater, just the things that they love to do being a child. So I think that as a parent, get the information, ask any of the questions, but do get that vaccine for your child.
And I just want to add one last component. I am a parent of a 16-year-old student athlete. And it was really imperative that I do my research and find out, is it appropriate for him to get his vaccine? I've had a lot of concern throughout the year about his ability to participate and the risk of his COVID exposure and what that might do for him and what kind of risk would that pose to my entire family. And so when the vaccine became available for him, we were ready to make that decision for him to get the vaccine. And so really think about the risks that poses to your child and to your family about how you would want to move forward to get the vaccine. Talk with your healthcare provider, but note that if there was any concern that the vaccine was not safe, I would have hesitated, but I was confident and assured that we were doing the right thing by getting him vaccinated. So I encourage parents, talk with your healthcare providers, as Director Hayden Howard said, but also really think about what is the best thing for your family and make that decision, just so you can protect yourselves and protect each other.
Thank you. All right, on to our second round of questions. This one from us here at KXAN. Can you describe the progress of the mobile vaccine effort?
Our mobile vaccine efforts actually began in February. We had a soft rollout working with partners, and we have shifted to work with Meals on Wheels. And since then, we have worked with so many organizations. That program has worked with nonprofit partners, but we have also have worked with, for example, City of Austin this week, going over to one of the city departments. And so that team has been very flexible. And so one of the changes, as you all are aware, when vaccines became available for everyone, the focus is making sure that we're taking care of the elderly and homebound. But if there are other members in the household that have not received their vaccine, when they call 311 to inquire about information, they can just let us know that they have 4 other people in the home. And we are providing at this time is Moderna or Janssen or J&J. So it is so important for us to continue to use that team to just be mobile in our community and go where people are, continue to work with partners, but also folks that are not connected to any other type of service, by them just calling 311 and our team will schedule and come over. The other thing that the team has done is that they provide education. Sometimes some folks are very nervous. We've noticed that some folks have a lot of anxiety about getting the vaccine. And so our team were able to really talk with them and explain and answer any questions that they have. And then they spend that additional time with them as they are just monitoring them and making sure that they're okay. So we will continue to use that team and be in apartment complexes and, just other smaller settings, but we'll continue to be able to go to homes as well.
Thank you. Next question is from the Austin American Statesman. The new APH risk-based guidelines appear to conflict with past statements about fully vaccinated individuals and how they can gather in groups. Just to be clear, can fully vaccinated individuals gather in private groups with partially vaccinated and non-vaccinated individuals indoors without wearing a mask? I'll repeat that if you need me to.
No, I got it. Thank you, Sally. People who are vaccinated certainly have more freedom to go maskless than those who are only partially vaccinated or unvaccinated. So yes, individuals who are vaccinated can go maskless in situations like that. Again, part of the risk analysis is who else is in that group. So anytime one of those individuals who's unvaccinated is somebody who's at high risk for severe disease, it's important for those individuals who are, even those who are vaccinated, to consider wearing a mask in that circumstance. While the vaccines are very, very good, they are not 100% protective. So in that sort of circumstance, high-risk person who is unvaccinated, there needs to be a strong consideration to continue to wear masks around that person because of that risk, and to also encourage that individual to get their vaccine.
Okay, next question is from Community Impact. Dr. Escott, you said you have confidence we can achieve herd immunity locally, but it will be challenging on a broader scale. Will that affect our ability to fight the virus long term? People are traveling in and out of Central Texas every day, and we are not siloed as a community.
I think it will create a challenge for us. But when we think about herd immunity, we really think about controlled disease spread. We think about small numbers of cases, small clusters or individual cases where somebody who has a disease interacts with another person. There may be some transmission, but there is so much vaccination and protection around them that disease doesn't spread. So that's where I see that we could certainly be. And we're seeing that to some extent now. As that vaccination number rises, our cases continue to fall. Yes, variants create challenges to that. And there is likely to be another call for booster vaccinations as new strains emerge. But we'll still continue to have some protection from that initial vaccination effort. I think it is really up to all of us to, when we reach that stage of improved conditions here, when we drop down to stage 1 and hopefully to stage 0, that we turn our attention to how we as a community can support the rest of the state, the rest of the country, the rest of the world to get their vaccination. The better we protect the globe, the better we protect ourselves, and that has to be our commitment.
I'll just add that, we are locally, again, focusing on, as we transition our epi response, to focus on the variant surveillance to see what strains are actually circulating here in the Austin, Travis County area. We are concerned about this new strain circulating in Houston because we know it's just down the road from us. So the ability for it to be entering into our community is always there. We're looking at vaccine breakthrough cases, cases of reinfection, just to try to see if we can, gain additional information and knowledge about what those factors are that make people more at risk for those types of breakthroughs or reinfections. But again, the best thing you can do as a community member is to make sure you're vaccinated, because that will, place you in an advantage from those that are not unvaccinated. Especially, it gives you some level of protection against potential variant strains that might be circulating. And once we become vaccinated, it'll be better for us in general.
Let me just add one other thing on that. Remember that vaccination is not just to protect from transmission of disease. It's even better at preventing hospitalization and death from disease. So again, if we reach a stage where we have people who are getting mild illness but not ending up hospitalized or dying from it, that's a success also. And even as we see these variants emerge, we may find that people will get the infection, but they'll have a less acute course. And that's almost as good, and certainly that's going to impact our hospitalizations, our deaths, and certainly has the potential to save lives. That's again why it's critical that folks get their vaccination as soon as possible.
Okay, KOOP Radio is asking, how well is APH's outreach program doing to get the vaccine to those who cannot get to it?
The department has 7 agreements with nonprofit providers that are working throughout Travis County. One of the things is that we are also going to be working with United Way. United Way also has awarded about 15 contracts to nonprofit providers. Now they're going to be working regionally. However, since they will have several that are focused in providing outreach and education in Travis County, we are pulling all of those folks in together. They will be able to share information with each other. Created a Dropbox where they can, share information that has really helped and been successful, so it's more uniform. The other thing is just making sure that there are no gaps in the community. So this coordination between all of the nonprofit providers with United Way and our service providers is really going to help us to be able to share with the individuals when they're working with the clients that they serve, so they can connect them to vaccines. and get people in. So whether it's they're doing the walk-in where they are telling them exactly where to go, or they are doing the one-on-one conversations. Several of the partners are going door to door, having those conversations with folks, trying to get them signed up and connected to a vaccine. And so we know that there may be instances where there will have to be several conversations with an individual before they are ready. But we want to make sure that they have all of the updated information about how they can connect that individual to the vaccine.
I just want to add in, we're also working on a lot of other strategies as well to try to really focus messages to specific populations that have been disproportionately affected by COVID-19, including the outreach teams that are on the ground. That's important, grassroots efforts to try to connect people to vaccine, but also with focused texting, just to let people know, like, hey, there's a vaccine, a location available in your neighborhood. There's a lot of strategies that we're leveraging. And as Stephanie said, it requires multiple times to tell people there's vaccine available, to make sure that we have that message ready and out there. So when people come to that space that they're ready to get the vaccine, that they have the information readily available. So we're working on a lot of different strategies, from mass media to the on the ground outreach. There's just a lot of ways that we need to make sure that those tools we're using to get all of those things to everyone in the community so they know where they can get their vaccine.
Thank you. Next question comes from CBS Austin. What percentage of people who are not vaccinated do you think will be incentivized by a gift card, time off from work, etc.? How much of a difference do you think a small incentive can make?
I would say, since we are just initially having those conversations, that is not a percentage that we would be able to provide. But one of the things our hope is that there may be some business owners that are listening to us right now, and they are thinking about, how they can do things a little differently within their organization. Our hope is that folks are very flexible with their employees. As a community, it's going to take all of us to be on board. Even asking business owners, if they are even willing just to come forward to say, I'm willing to offer this coupon for an individual that may come in, either with their card or with their sticker. We have a marketing strategy where we're providing a sticker to individuals that have received their vaccine. And our hope is that maybe some of the businesses would offer some type of small, whether it's a, taco or a drink or, or something else to an individual, or even a coupon off of their purchase. So my hope is that others are listening and that they are thinking about ways of how they can contribute to help Austin be a healthier place and incentivize folks coming into their businesses that they know that have received their vaccine.
Okay, next question is from KUT. Austin has named a new health authority, Dr. Demar Walks. Austin Public Health Director Stephanie Hayden Howard is also transitioning to a new role within the city. How will you ensure smooth transitions amid this continuing pandemic?
I think one of the things to keep in mind is Dr. Escott and I will both remain City of Austin employees. And so that in itself should definitely ease the mind of individuals that may be concerned. I think one of the things is that being able to have other individuals to come into this space that have the experience, that have done very well in their career paths is definitely a benefit to the city of Austin. As we continue to transition, I will continue to be around. Health is one of the areas that I will oversee. And so I will definitely continue to be involved with things that are going on as we start to transition.
And let me add on to that. I've come to know Dr. Desmore Walks over the past year since she has been the health authority for Bastrop County. We've collaborated on a number of issues over the year, and I've been very impressed with her, with her capabilities, with her passion, with her drive, and I think we'll be well served by her. I look forward to continuing to work with her in our both new roles. Again, as Director Hayden Howard said, we're not going anywhere, so we will certainly be around to continue to support the interim director and our new health authority.
Okay, y'all, we're up to our last question from KView. Roughly, how long would it take for Pfizer to be approved for full FDA approval for the COVID vaccine? And do you think it would make hesitant people more willing to take it?
I'm happy to take that one. We know that they've submitted the application to transition from EUA to full approval. That may happen in the next month or so. We'll have to wait to see if that gets scheduled and when that will be deliberated. Certainly, given the efficacy and the safety that it's demonstrated in real life examples after millions and millions of doses, I don't see any challenges at all to transitioning from that emergency use authorization to full approval. I think with that, it will certainly bring some confidence from those who may be hesitating, those who didn't want to be the first in line to get vaccinated, but are happy to be somewhere else in line. I think it will impact them. I think it will provide some reassurance that the safety is there. I think we can also expect that when these vaccines transition from EUA to full approval, that employers and schools, universities may also transition their guidance for the vaccine. We know that already some healthcare entities are starting to require vaccine for their employees. I expect that we're going to see more and more folks transition from voluntary to required if and when it is approved. This one and others are approved for full approval from the FDA.
Thank you, Dr. Escott. At this time, we will now transition into our closing remarks. But as a team, we would also like to say we thank you, Dr. Escott and Stephanie, for your leadership during this time, and we wish you luck. Over to you, Stephanie.
Oh, thank you very much. We are very excited about the transition to Assistant City Manager. As most of you have known, I've been with the city for 20 years, and I've spent the majority of my career in the health department. And so working very closely throughout this year, I think has really, really made us all stronger. The department is stronger, the relationships that we have within the city, but then outside of the city have been strengthened. And so we are really excited of where we are, but we're excited about where we're going to go. And so as we move along, we know things will be left in great hands. Assistant Director Adrian Stirrup will transition effective May 10th. I will continue to work very closely with the health department. I think that being in the Assistant City Manager role will allow me to continue to have further conversations with the city manager, but the entire city management team. And so the importance of public health has really, really shown. And so for our community, more people know what public health is, more people know what epidemiology is. And so I am very excited about where we are as a community. We still have more people to get the vaccine. And, you know, we still have lessons to learn. So over the years, we've had some tried and true lessons that have kept us safe during this time. And we will continue to come together as a community. We are stronger together. With that, I'll transition over to Dr. Escott.
Thank you, Stephanie. And I just want to say it's certainly been a pleasure to have the opportunity to work closely with Director Hayden Howard, now Assistant City Manager Hayden Howard. I've learned a lot from her, and I look forward to continuing to work with her in our new roles. And also supporting, as she said, Interim Director Stirrup and Dr. Walks in their new positions. We've built a strong team. We have a strong team. We have very talented and passionate people working for the City of Austin, for Travis County, and certainly throughout the community. And that is what has led us to where we are, and that is a city that has weathered this storm better than all others in Texas, and certainly most in the United States. So again, we have more work to do. 85% of our new cases in the past week are from individuals less than age 50. We're doing great work in our vaccination effort. We have more work to do. We need people to continue to show up, to roll up their sleeves, and to get their shots so that we can push past COVID-19 response piece and turn to recovery. We know recovery will be long and will be challenging, but we are certainly up to the challenge. And if we continue to band together as a community, we will get through it together. With that, I'll turn it over to Janet Pichette.
Thanks. And I'd like to also thank Director Hayden Howard, or our Assistant City Manager Hayden Howard, and Dr. Escott for their leadership over the last 14 or 15 months. It's been incredible to have their support and leadership at the helm here at Austin Public Health, and to respond. There have been some tough battles we fought along the way, so I've appreciated their support and leadership as we've progressed through this pandemic. And I continue to be here to support them in their new position and roles as well. Again, as we see cases beginning to plateau here in the Austin, Travis County community, we do have new variant strains that we're going to be focusing on, and we want to continue to monitor. And our focus in epidemiology will focus on doing that variant surveillance, investigating breakthrough infections and reinfections. And while we are still investigating case investigations, we will be continuing to look at clusters and outbreaks that occur throughout the community to make sure that if we do see a hotspot somewhere, we can tamp it down pretty quickly. Again, it's very important to get vaccinated. We encourage you to get vaccinated if you haven't been. It's just added protection for our community and for your loved ones. We want to be living in a healthier Austin and Travis County, and I think that's one way to get there. And with that, I'll turn it over to Cassie.
Thank you, Janet. And I just also want to reiterate Janet's words and just give sincere gratitude to the service and dedication that both Dr. Escott and Stephanie have provided to this response and to public health over the years. We know that it's been a week of change, and seeing both of y'all move into new and expanded leadership roles, I think for public health is exciting because you have a true understanding and knowledge of the public health role and the importance that it plays in protecting the community. And we're excited to have our interim assistant director move into, our assistant directors move into the director component, because she's been an important colleague. Adrienne Stirrup is fantastic, and we're excited to see her, and Dr. Walks to have her join our team. For us, moving into this week and knowing that it is a week of change, lots of new things are coming on, lots of things changing the vaccine scene. We want to always encourage folks just to get out there, get your vaccine. We know there's a lot of options for you. Again, if you're concerned about your ability to pay, or if you need an ID, none of those things should be a barrier. You don't need your ID. You don't have to worry about cost. The vaccine is free. And if you are concerned about having to demonstrate immigration status, that's not required. You don't have to provide any proof of residency. You just need to come out and get your vaccine. So we want to encourage everyone, get your vaccine, call 311, noting our locations are available most days, Tuesdays through Saturdays, every day of the week. So please contact 301 and find out where you can go to get and walk up and get that vaccine. With that, we hope you have a great weekend and make sure to take care of each other.
Thank you, Cassie. This concludes our media availability for today. Thank you to APH Directors Stephanie Hayden Howard, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, Cassandra De Leon, APH Chief Administrative Officer for Disease Prevention and Health Promotion Division,